Here's something most men don't want to admit, including me when I first started seeing it in patients. The problem isn't something you feel coming. It builds quietly, over years, while your life goes on normally. You're sleeping through the night, you're feeling fine. And somewhere deep in your lower abdomen, something is slowly changing, growing, pressing. And then one day you notice you're in the bathroom again at 2 in the morning, wondering when this became your new normal. I'm Dr. Natalia Parker, and what I'm about to show you today is going to completely change how you think about what's already in your kitchen. Because here's what most men never hear from their doctor. The foods you eat every single day are either feeding the process that's ruining your sleep and hijacking your bladder, or they're fighting it. And there is one specific category of food, ordinary, affordable, sitting in grocery stores across America right now, that has some of the most powerful and scientifically supported effects on prostate tissue that I know of. I'm talking about nuts, 5 specific nuts. And before this video is over, I'm going to tell you which one is the single most important nut I believe every man over 50 should be eating daily. But I'm not going to tell you that yet, because first, you need to understand what's actually happening inside your body, because once you understand the mechanism, that one nut is going to make a lot more sense than it does right now. Stay with me, this matters more than you think. Let's start with the prostate itself, because most men have a vague idea of what it is and almost no understanding of what it actually does or why it causes so many problems. Your prostate is a gland, small, about the size of a walnut when it's healthy. It sits just below your bladder, and here's the critical detail. It wraps around the urethra, the tube that carries urine from your bladder out of your body. That position, wrapping around the tube, is everything. Because when the prostate grows, as it almost always does as men age, it doesn't just expand outward into empty space, it tightens inward, around that tube, like someone slowly tightening a grip on a garden hose year after year until the pressure starts affecting flow. The medical name for this process is benign prostatic hyperplasia, or BPH. The word benign is doing a lot of heavy lifting in that diagnosis. It means not cancerous. And yes, BPH itself is not cancer. But I need you to hear this clearly. Benign does not mean harmless. It does not mean comfortable. And it absolutely does not mean something you should just live with and accept. The symptoms of untreated BPH destroy quality of life in ways that are rarely talked about honestly. The urgency that makes you panic when you're 20 minutes from a bathroom. The weak stream, the hesitation, the dribbling, the sense that nothing is moving the way it should, the feeling that your bladder never fully empties. And then the nights, getting up at 1 in the morning, then again at 3, sometimes at 5, lying awake afterward, too alert to fall back into real sleep. What most men don't connect is that this sleep disruption isn't just an inconvenience. Fragmented sleep, night after night, destabilizes your entire hormonal system. Testosterone drops. Growth hormone, which repairs tissue overnight, doesn't complete its work. Cortisol rises. Everything downstream from sleep quality starts to falter, and most men never trace it back to what's happening in their prostate. Here's the underlying biology most standard appointments don't have time to explain. BPH isn't just mechanical. The process driving prostate enlargement is fundamentally inflammatory. Chronic, low-level inflammation in prostate tissue creates an environment where cells are under stress, immune signals are dysregulated, and the hormonal feedback loops that control cellular growth are disrupted. Your body, trying to respond to that inflammatory stress, ends up accelerating the very process causing the problem. And your diet influences that inflammatory state every single day. Processed foods, refined oils, high-sugar diets, these flood your body with the building blocks of inflammation. But certain natural foods do the opposite. They deliver compounds that specifically target the inflammatory pathways driving BPH, reduce oxidative stress in prostate cells, and support the hormonal balance that keeps cellular growth in check. The 5 nuts I'm about to walk you through are among the best examples of this in nutritional science. Each one targets a different part of the problem. Let's go through them. Number 5, the pistachio. Most men think of pistachios as a party snack. They're not thinking about prostate health when they crack open a shell. But what's inside that shell does something very specific inside your body, starting with an amino acid called arginine. Your body uses arginine to produce nitric oxide, a signaling molecule that tells blood vessel walls to relax and widen. Better vasodilation means better blood flow, and for your prostate, blood flow is everything. The prostate needs continuous adequate circulation to receive oxygen and nutrients and clear metabolic waste. When blood flow to the pelvic region is chronically poor, which it often is in men with BPH, tissue becomes stressed and inflamed, muscles tighten, pressure on the urethra increases, and symptoms worsen. Pistachios also contain plant sterols that modulate the hormonal signals driving prostate cell growth, and lutein and zeaxanthin antioxidants that protect prostate cells from oxidative damage. There was a clinical study, just 3 weeks long, in which men who consumed a daily handful of pistachios showed measurable improvement in blood flow to the pelvic region and significantly better urinary function scores. 3 weeks. A daily handful of a nut most people already enjoy. The results were real and measurable. Pistachios also contribute to a healthy body weight, which matters for prostate health in a direct mechanical way. Excess abdominal weight puts physical pressure on the bladder and worsens urinary symptoms. It also drives systemic inflammation, creating a feedback loop that accelerates BPH progression. The fiber and healthy fats in pistachios support satiety, help your body regulate weight more effectively, and contribute to the kind of metabolic health that creates a better internal environment for your prostate. Let me ask you something before we keep going. Drop a comment below and tell me what state you're watching from, because I see men dealing with this exact situation from every corner of this country, and I genuinely want to know where you are. If you're watching internationally, tell me your country. This conversation is bigger than any single location. Number 4. The almond. Most people know almonds are healthy. Most people do not know why almonds belong specifically on a prostate health list. Let me explain. A single 1-ounce serving of almonds, a small handful, contains 48% of your daily recommended vitamin E, nearly half of everything you need in a small handful of nuts. Vitamin E is one of the most important fat-soluble antioxidants in the human body. It integrates into cell membranes and protects them from oxidative damage. For prostate cells, which are under continuous metabolic stress and elevated free radical exposure, this kind of membrane protection is clinically significant, but the form of vitamin E in almonds matters too. The brown skin of the almond contains the highest concentration of vitamin E and other antioxidant polyphenols. When you eat almonds with the skin on, which is how they're sold raw, you're getting the full antioxidant profile, not just the interior of the nut. Here's the piece of the almond story that surprises most men. Almonds are a prebiotic food. The fiber and polyphenols in them feed the beneficial bacteria in your gut. And your gut microbiome is one of the primary regulators of systemic inflammation throughout your entire body. When your gut is healthy and balanced, inflammatory signals are kept in check everywhere, including in your prostate. When the microbiome is disrupted through poor diet, antibiotic use, chronic stress, or aging, inflammation rises systemically, adding more pressure to tissue that is already struggling. Almonds address that indirect but real driver of BPH from the inside out. It's one of the most underappreciated mechanisms in prostate nutrition. Beyond vitamin E and prebiotic activity, almonds contain magnesium, a mineral that plays a role in hormone balance, including testosterone, and healthy monounsaturated fats that support cardiovascular function and blood pressure regulation. Both of these contribute to the improved circulation and hormonal environment that healthy prostate tissue requires. The practical advantage of almonds is their versatility, raw as a snack, sliced into oatmeal, blended into a smoothie, or as almond butter on toast. There's no shortage of easy daily ways to include them, and consistency is what produces results. Number 3. The pecan. Rich, buttery, deeply satisfying. Most men think of pecans as a pie ingredient or a holiday treat. they are not typically thinking about prostate health when they reach for a pecan. But there are two specific compounds in pecans that put them firmly on this list, and both are clinically relevant. The first is gamma tocopherol. This is a specific form of vitamin E, and the distinction matters. The vitamin E that most people talk about, the kind in supplements, the kind in fortified foods, is alpha tocopherol. But research has shown that gamma tocopherol is uniquely effective at neutralizing a specific category of free radicals called reactive nitrogen species. These are the exact types of damaging molecules most strongly associated with prostate cell injury and the cellular dysfunction that contributes to abnormal growth. Alpha tocopherol is less effective at this specific job. Gamma tocopherol does it better, and pecans are one of the best natural food sources of gamma tocopherol available. The second compound is beta-sitosterol, a plant sterol that has been studied specifically for its effects on BPH. Beta-sitosterol has a documented ability to interfere with the hormonal signals that trigger prostate tissue expansion. Clinical studies have shown that men who supplement with beta-sitosterol show measurable improvements in urinary flow rate and reductions in post-void residual, the amount of urine left in the bladder after urination. These are the exact symptoms that disrupt daily life and fragment sleep. And pecans deliver beta-sitosterol through food, not pills. Pecans also have a remarkable effect on cardiovascular health. Studies have found that adding a daily serving of pecans to a healthy diet can approximately double the cholesterol-lowering effect of that diet on its own. Better cholesterol profiles mean less arterial plaque, better blood vessel elasticity, and more efficient circulation throughout the body, including to the pelvic region. Better blood flow to your prostate means more oxygen, more nutrients, and less inflammatory congestion in the tissue. It's one of the clearest examples of how prostate health and heart health are part of the same system. Pecans also contain zinc and magnesium in meaningful amounts. The prostate gland contains the highest concentration of zinc of any organ in the male body, and for good reason. Zinc plays an active role in the cellular processes that maintain prostate tissue health and regulate the enzyme activity that keeps prostate cells dividing normally. When zinc levels are chronically low, prostate tissue becomes more vulnerable to inflammation and dysregulation. Pecans help replenish zinc through food, consistently and naturally. A small handful of pecans as an afternoon snack, chopped into your morning oatmeal alongside almonds, tossed into a salad, mixed into a homemade trail mix. These are small additions to your daily routine that compound in their effects on your prostate over weeks and months. Now, I need to pause here because I want to tell you about something my team put together specifically for men watching this video. We created a comprehensive resource called the Medical Guide to Avoiding the Mistakes That Damage Your Prostate After 60. This guide goes deeper than anything I can cover in a single video. It covers the nutritional strategies we're discussing today with full clinical context, the specific lifestyle habits that silently accelerate prostate problems in men over 60, the foods and daily patterns that most men don't realize are making their BPH symptoms worse, and a step-by-step action plan for protecting your prostate starting today, without confusion, without guesswork. It's completely free. You'll find it in the pinned comment right below this video. If you're serious about this and you're still watching, so I know you are, please go grab that guide after this video. It's one of the most useful things I can put in your hands right now. Now back to the list. We have 2 more nuts to go, and the last one, the number 1, is where this entire conversation has been building. But first, number 2. Because what's inside this nut is unlike anything else you'll eat, and the effect it has on your prostate is one of the most targeted nutritional relationships in all of men's health research. Number 2, the Brazil nut. If you've ever dug through a can of mixed nuts looking for the large, smooth ones with the creamy texture and mild, buttery flavor, you already know what a Brazil nut looks like. But I'd be willing to bet you've never thought about what's inside it in terms of prostate protection. And this is where things get genuinely surprising. Brazil nuts are the single richest dietary source of selenium on the planet. Not just a good source, the richest, by such a wide margin that it's in a category of its own. A single Brazil nut, just one, can provide more than 100% of your daily recommended selenium intake. One nut. That level of concentration in a natural food source is essentially without parallel. Now, here's why selenium matters so critically for your prostate. Selenium is a trace mineral your body uses to build a family of antioxidant enzymes called glutathione peroxidases. These enzymes don't just neutralize individual free radicals, they work continuously and systematically, eliminating the reactive molecules that cause oxidative damage to cell membranes and DNA, including in prostate tissue. Your prostate is metabolically active, which means it generates significant free radical byproducts from normal cellular function. Without adequate selenium to power these enzyme systems, those free radicals accumulate, they damage prostate cells, they trigger inflammatory responses, they disrupt the cellular signaling that keeps prostate tissue healthy. Over time, this oxidative damage creates the chronic cellular stress that drives BPH progression. The research on selenium and prostate health is among the most consistent in nutritional medicine. Study after study has found a clear inverse relationship. Men with lower blood selenium levels have a significantly higher rate of prostate problems. Men with adequate selenium levels show meaningfully better protection. This connection is so well established that selenium status is now considered one of the key nutritional markers for men's prostate health. What makes Brazil nuts particularly valuable from a practical standpoint is their incredible efficiency. You don't need to eat a large quantity. You shouldn't eat a large quantity. Selenium, like all trace minerals, operates within a therapeutic window, and excessive intake over long periods can cause toxicity. The sweet spot for most men is 1 to 2 Brazil nuts per day. That's it. 1 or 2 nuts delivers the selenium your prostate antioxidant systems need to function optimally. It's one of the smallest daily habits available with one of the most direct, targeted effects on prostate tissue protection. Keep a few at your desk. Add 1 or 2 to your morning trail mix. Eat them raw from the bag. Zero preparation required. The barrier to making this a daily habit is as low as it gets. But as remarkable as Brazil nuts are, they do not top this list. Because the nut in the number 1 position delivers something Brazil nuts don't. A combination of mechanisms so broad, so well studied, and so directly relevant to the exact biological processes driving BPH that its effects on prostate health go beyond what any single compound can accomplish. This nut attacks the problem from multiple directions at once, and if there is one food I would tell every man over 50 to add to his daily routine without hesitation, this is it. Number 1, the walnut. Walnuts are old, ancient actually. They're one of the oldest tree foods consumed by human beings, cultivated for thousands of years across Asia, the Middle East, and throughout Europe. Ancient cultures didn't have access to the kind of clinical research we have today, but they understood through generations of observation that walnuts did something for men, for energy, for vitality, for overall resilience. They treated them as medicine as much as food, and modern science has now mapped out exactly why that intuition was correct, and why it applies specifically to your prostate in a way that is more powerful and comprehensive than almost any other natural food. Let's start with omega-3 fatty acids, because this is the foundation of everything that makes walnuts exceptional for prostate health. Walnuts are the single richest nut source of plant-based omega-3 fatty acids in the world. Specifically, they contain alpha-linolenic acid, or ALA, the plant-based form of omega-3 that your body can use directly and can also convert, in part, into the longer-chain omega-3s that regulate inflammation throughout your tissues. A small daily serving of walnuts provides the full recommended daily amount of ALA your body needs. Here is why the omega-3 content of walnuts matters so profoundly for your prostate. The biological process driving BPH is fundamentally a fat metabolism issue. Your body regulates inflammation through molecules called prostaglandins, which are derived from the fatty acids in your diet. When your diet is dominated by omega-6 fatty acids, abundant in processed foods and refined vegetable oils, the prostaglandins your body produces tend to be pro-inflammatory. They amplify the immune response. They drive tissue swelling. They accelerate the cellular growth signals that cause your prostate to keep enlarging. Omega-3 fatty acids shift that balance. By giving your body the raw material to produce anti-inflammatory prostaglandins, omega-3s change the hormonal environment inside your prostate tissue. The chronic inflammatory state driving growth and worsening symptoms starts to quiet down, not overnight, but consistently, week over week, as the ratio of omega-6 to omega-3 in your cellular membranes shifts in a healthier direction. Studies looking specifically at walnut consumption and prostate health have shown measurable reductions in PSA levels in men who increase their omega-3 consumption. Markers of oxidative stress in prostate tissue go down. The cellular damage that drives abnormal growth is reduced, and the urinary symptoms associated with BPH, the urgency, the weak stream, the nighttime trips, show consistent improvement in men who maintain a consistent high omega-3 diet. One notable study found that men consuming a daily serving of walnuts for just 8 weeks showed significant reductions in PSA levels and measurable improvements in biomarkers related to prostate inflammation. That's detectable change in blood work from a food most people walk past in the grocery store. Yes, melatonin, the same compound your brain's pineal gland produces to regulate your sleep-wake cycle. Walnuts contain natural melatonin in a form that is bioavailable when consumed. And this piece of the walnut story deserves more attention than it usually receives because for men dealing with BPH, the relationship between sleep and prostate health is a two-way street that becomes a self-reinforcing downward spiral if nothing is done to interrupt it. BPH disrupts sleep. We've established that. The nocturia, getting up 2, 3, 4 times a night, fragments the sleep architecture that your body depends on for hormonal regulation, tissue repair, and immune function. When sleep is fragmented, testosterone production drops. Growth hormone, which is secreted in its greatest amounts during deep sleep, doesn't complete its restorative cycles. Cortisol rises, systemic inflammation increases, and that increased inflammation in turn makes prostate symptoms worse, which disrupts sleep further, which worsens inflammation further. This cycle doesn't break on its own. It needs interruption at multiple points. The omega-3s in walnuts attack the inflammatory pathway. The antioxidants protect prostate cells from oxidative damage. The L-glutathione work against the growth signals driving BPH. And the melatonin supports the sleep architecture that your hormonal and immune systems depend on to stay calibrated. It is a comprehensive, multi-pathway intervention in a single daily food. There is one more aspect of walnut consumption that is worth mentioning because the data is compelling and the mechanism is well understood. Several research studies have looked specifically at regular walnut consumption and prostate health outcomes in men. One notable study found that men who consumed a daily serving of walnuts, roughly 2 ounces, showed significant reductions in PSA levels and markers of prostate cell stress after just 8 weeks. They also showed measurable improvements in biomarkers related to inflammation and oxidative damage in prostate tissue. 8 weeks, 2 months of a daily handful of walnuts produced changes that were detectable in blood work. That's the kind of data that should make you take this seriously. A daily serving of walnuts is about 1 to 2 ounces, roughly 14 to 28 walnut halves. You can eat them as a mid-morning snack, mix them into oatmeal with almonds, blend them into a smoothie, or keep a bag at your desk. The practical barrier is nearly zero. The evidence for their benefit is among the strongest in all of nutritional prostate health. So here is where we are. 5 nuts, 5 different mechanisms, all pointing in the same direction. Pistachios improving blood flow through nitric oxide and supporting hormonal balance through plant sterols. Almonds delivering vitamin E cell protection and prebiotic gut support for systemic inflammation. Pecans providing gamma-tocopherol, beta-sitosterol, and zinc for multiple layers of prostate defense. Brazil nuts supplying selenium to power your antioxidant enzyme systems. And walnuts delivering omega-3s, L-glutathione antioxidants, and melatonin to fight prostate inflammation at multiple levels while supporting the sleep quality your hormonal systems depend on. I want to be clear, these 5 nuts are not a cure for BPH. If you're dealing with significant symptoms, you need to be working with a doctor. A prostate exam and a current PSA test are not optional. No food replaces proper medical care. But your diet is shaping the internal environment of your prostate every single day, whether you're thinking about it or not. Every meal either contributes to the inflammation pressing on your urethra and waking you up at 3 in the morning, or it fights it. The 5 nuts we've discussed today are some of the most accessible, evidence-backed tools available for shifting that daily influence in the right direction. Start with walnuts. Add a daily serving to your morning routine. Stay consistent. Give it 6 weeks. Most men who make this kind of consistent dietary shift begin noticing meaningful improvements within 3 to 6 weeks. Less urgency, fewer nighttime interruptions, more energy during the day because the nights aren't being shredded. These changes are real, documented, and available to you starting now. If this video gave you something useful, subscribe to this channel. Every week I put out content specifically for men who want honest, evidence-based answers to the health questions that matter most after 50. Not generic reassurance. Real explanations of what's happening in your body and what you can actually do about it. The choices that will protect your prostate start today. A bag of walnuts on the way home. A handful of Brazil nuts in the morning. Small daily habits, repeated consistently, are where real change begins. Take that seriously. Your quality of life depends on what you decide next.